Trenbolone, monster horsepower steroid on the planet. Guys, stick with me in this video as I walk you through a real case study of a man who came to see me with Tren in his pocket, asking, Doc, I want to take Tren, I want to get to the next level, I want to talk about it, Doc. And I brought him through. We talked through it. I respected him. In the end, he came up with his own alternate plan. I want you guys to see and hear what that plan was. A real patient that I saw the other day. Let's call him Joe. Joe comes to me, he's in his late 30s. He is already a beast. Joe is an intermediate steroid user, been on testosterone. He loves Masteron, combinations with little baby doses of Anavar. Joe is not a professional bodybuilder. He just loves to be strong. Joe's about 5'9". He weighs about 205 pounds. He's very lean, he's very handsome, and he's very healthy. He actually did his calcium score. Joe, great job. And like many men, he sets up to see me. We have labs. We have the calcium score that was 0 with the grace of God, and Joe's in great health. Joe comes in to see me, and he brings his bottle of Tren, and he trusts me. And I can't tell you how much that means to me, guys, that I've been doing this and you trust me, because as a physician and a man leader in the world, to protect you guys, this is all I care about. Quick pause for a second here, guys. Chances are you're watching this video, you're on a little testosterone, maybe even some steroids, and your blood pressure is just not right. Maybe you're hypertensive. Very important, guys. You got to monitor your own blood pressure. You got to take matters into your own hands now. So check out this monitor. It's a home monitor. This is the one I recommend for most of my patients for many years. Omron Platinum. If your arm is a little big, even 16 inches or bigger, you're going to need the big cuff. So get that on the side. Guys, go home, take your blood pressure in the morning and at night. Put it together, document it, research it. I'm going to help you with other videos. And then you need to make adjustments in your life to keep your blood pressure perfect. And if you do that, I promise you, you're going to stay stronger and healthier for more time and a better quality of life. Boom. So Joe sits down and we meet and we go right into his chief complaint and his history of present concern. And he said, Doc, I'm ready to take Tren. And he pulls it out, here it is. I said, all right, well, let's talk about Tren. So we talk about Tren, and he already has enjoyed the benefits of some steroids, and he's being very careful, actually. And I know a lot of you guys are aware of this, and he doesn't want to have side effects. When he takes even a little bit too much testosterone, because he's kind of like a light blasting and cruising guy, like 200, 250 of test, and he'll add a little bit of Masteron for months at a time, and he kind of comes off it, and he'll even add on training days Anavar. So now he's ready for Tren. So we talked about it, and I said, Joe, let's talk about the short-term complications and what's going to happen to you on Tren up front. You know, forget the long-term stuff with the heart and the kidney and all this kind of stuff, you know, because it's important, obviously, but the truth is, the short-term complications are what we're going to talk about here, and what's going to hopefully deter you from considering not taking Tren or never taking Tren or not doing it again. So you're going to take Tren, Joe, and you're going to be a beast. You're going to feel great if indeed you can take the injections, and beyond the Tren cough, which, guys, it's no joke. It can be debilitating. I don't think it's going to kill people, but it's very uncomfortable. And it scares guys. There is acute anxiety and even panic attacks from Tren, not just from after the direct injection, but in the subsequent hours or days or weeks. We all know that there are steroids and rage, and is steroid rage and roid rage true? Well, there's really no data on it. And I could tell you, everyone says that there's the asshole doc, and then now it's an asshole on steroids. So there's testosterone, there's steroids, then there's Tren. And it seems like Tren, everyone's going to agree, the top pros in the world in bodybuilding, powerlifting, and strength sports, and other sports that I work with continually, have said that, you know, Tren is really a game changer, and it will change your personality and could make you aggressive and very short fused and really kind of turning you into a dick, and a rude, short fused, mean man. So that's up front, okay? And we talked about that. And the panic attacks. Now, Joe has told me that when he's on even just higher doses of test with the Anavar, that he gets anxious. He can get very anxious, and that's a limiting piece of why he doesn't run the Anavar too long, which is very interesting. Now, the most important piece, and I think in closing, guys, and please follow me on this, guys, really, let's get comments on this. This platform is where I stimulate you guys openness and truth and honesty, and then you give comments for other men to read. I think the comments are equally as important as my topics and my discussions, but the topics discussion down below in the comments are so important because men are going to read this. So the sex drive. When you take Tren, your sex drive is going to go through the roof. Again, some guys will have Tren dick and it's going to go the other way. It is a Nor-19 drug. There's Tren, there's Deca in this class of drugs. But it's interesting that for 90% of men or more, when they add Tren to testosterone, of course, for a cycle, sex drive goes up. What's going to happen? So many men have called my office over the years. So many men have consulted me that what happens to that sex drive? Is it worth it? And first of all, you could, we're men, and even women, you can make mistakes and you're not thinking properly because your sex drive is so high, and you could make poor decisions. But beyond that, when the sex drive goes up high, and then you have to stop Tren, you have to come off Tren sooner or later, what happens to the sex drive? Guys, I'm telling you, you got to believe me, the sex drive doesn't always just come back. Now, this is with testosterone on board. I've had so many men tell me that they've tried to do post-cycle therapy with all combinations of HCG, tamoxifen, and Clomid, and different combinations of testosterone with Masteron and Proviron. And they've given it time. They've checked their labs, and they have no health consequences. Again, these are young men that are otherwise very healthy. And this is a psychiatric thing. Now, this is a brain thing. This is a stimulation of the limbic brain, guys, the sexual brain, and why it's so incredible being on testosterone, if of course you need it. And now you're adding in Tren. Sex drive is going to go through the roof. It is going to come down. What does go up, guys? You can imagine has to come down. Again, I know there are men out there that can look like they're living on Tren, little baby doses on top of testosterone for years, and they're okay. Then you have to think, what's going to happen to the health consequences? But again, sex drive. And when I told this to Joe, he looked at that bottle of Tren and he said, Doc, do you have a garbage can? Is there a garbage can? I said, yes. But Joe, please let's not dispose of that in my office. He said, Doc, I love you. Took it, put it back in his pants. He got up and he gave me a hug and he said, Doc, can you make a video called Tren is Garbage? This is it, guys. So Joe, for today, is not going to take Tren. He said it's garbage, and here's the video for you, Joe. So what turned Joe off was, I think, the anxiety potential, the nature of it's going to change his personality, and the most important thing, I saw his eyes. I saw his eyes light up when I hit him with the sex, because his sex is outrageous on testosterone. And he has his mechanisms where he adds little doses of Masteron, and he adds his very limited doses of Anavar. And this guy already is a beast. And I don't give a blessing on that, guys. But again, this is a clinical vignette. It's a clinical study of a healthy man that is on steroids, and he wants to go to the next level with Tren. And we did it. For today, Joe, I hope you threw it out, buddy. Hope you disposed of it properly. And I'm so happy that I met you, Joe, and you're the man that is behind this video of why Tren is truly garbage, guys. So let's get comments, guys. That's it for today. I really hope this helps everyone in the world. Let's crank it up. I want to hear very, very specifically your experiences with tren, and I want to hear why maybe you've stayed away from tren. Thank you so much, guys. Rock on.